Hi, I'm Dr. Johnny. Thanks for joining me today for a special video. This is an important one. It was a subscriber to this channel who spent $3,000 to $4,000 on skin tightening for a jawline. And I was compelled to do a little tutorial. See if you can find out from a picture. I'm going to show you a before and after, kind of what was done. Take you through a progression of a patient who doesn't have a strong jawline, in the middle in the progression, and then to a final, something we're happy with. In between, I'm going to see if you can pick out what was done. I'm going to demonstrate to you what was done and what was done to change the angle, create length, and what you can do. The worst thing you can do is get the wrong procedure, because as you know, these are expensive, and many people, money is nothing, it's fine, but the majority of people have a certain budget that they can spend, and you're trying to figure out what should you spend your money on. Is it angles? Is it glow? Is it skin projection? Is it mimicking bone? Would hormones be better? You know how we talk about bone loss, sagging skin. Where's the face aging first? If you're younger, and I'm going to do some videos of projecting age, and we're going to talk about it. All of this is to help you decide what to do, because what I'm finding out from these videos is you want to know how this all applies to you. Glass skin, Ulthera, fillers, jawline, under eyes. This video is going to do just that. Let's get started right now. Okay, so remember to like the videos. If you don't like the videos, still like the video, click the like, and tell me in the comments below what you did or didn't like. But I think you're gonna like this. I'd like to do more of these. It's all about education. Let's go to the video, and once at the end of the video, there's gonna be 4 blocks. And you can click on those blocks to get more information. They're videos of the angles and folds, what I'm showing you now, and how it applies to the injections that I do. What is it that you can do? One of the things that we're going to do is jawline and gonial angle, and you're going to be able to see those injections. So it's kind of like your homework to this video, and I'll put it also in the description of this video. Let's go right to the whiteboard now. Okay, so here is the before. There's an after, and we're going to label that 1 because we're not happy with that after. We might think we are, but we're not fully happy, and I'll tell you why. But what I want to demonstrate here is the jawline projection, and let's look at what's changed in the facial angles. This is obviously someone who's beautiful already, has great skin, great glow. They may come in questioning this area, the submentum. That's typically what the patient's going to ask about. However, when I talk about it all the time, I always talk about lip filler, and I talk about creating beauty. And this patient has, if you look here, a pre-existing beautiful lip projection. Looks like a nice volume. So there really isn't a lip issue there, but you might think so, or she might think so. We have the benefit of looking at a side 90 degree. And a lot of times patients here, or I should say viewers here on YouTube, will ask me, hey, do I need this? Do I need that? And they send a glamour picture in the bar having a cocktail. The lighting's all over the place. The angle is, I can't make anything of it. We need 5 views. And I know people get frustrated with that. Here is one of the 5 views, and it's a 90 degree. And you can see I need the 5 views to look at this line here, which is the Ricketts line or AE line, and to look at the submentum properly. Okay, so if we go back here now and we look and take a look at our patient, she actually doesn't have a submental problem. It's more, look at the after 1, because we're going to do another after. We increase the length here, we create beauty, and look at her, and now paying attention to that. We have a much longer submentum, but more importantly, we've augmented the chin, and you can see that here. We have a nice augmented chin. And why that's important, and why when we're talking lip filler it's important, is because if you look now at the line from the chin that goes up through the nose, this is an AE line or a Ricketts line, and you can study those. But those are important to look at. But just looking at her here, we see it makes much more of a difference. This side, the after one, she has a prettier projection, everything looks good, and one we would say is from a jawline. Now, how do you achieve it? I want to show you one more video or one more slide of a before and after before I go on to saying, hey, how does this apply to you and how do you get it? If this patient came in for Kybella, radio frequency, skin tightening, skin glow, what would we say? No way. What she needs is angles. If she needs anything or wants anything, she needs angles and folds. So you see the after here. Let's go on to the final after picture. Is here her original before, and here is the after too. Okay, which do you like better? Do you see a difference from the after one that we showed prior? And if you're astute and if you're looking, what it's going to be is this. And I often talk about, and you see me measure it in the patients. Let's measure, we'll do a jawline measure here for you too. Let's see, do you know what your number is?
I don't.
Everyone wants to know their number. Let's see. Do you want the perfect number?
I do.
Okay, well, you are perfect. And your number is, you are at almost, you're 125. Almost 130. It's perfect.
Is it?
It's perfect.
Thank you.
It's wonderful. Yes, right? And if the universe didn't give it to you, don't you worry, because you have me.
I know, exactly.
Right?
You're so right.
This is the gonial angle. And I'm going to remove this so you can see and you can get a look and see if you pick that up. But by adding here to the gonial angle, by creating volume, we create a shadow here and actually a projection if you got to see the PA view or the straight on view. And that really helps create beauty. Now we know that bringing the chin out here helped with the lips and the nose. She might even come in thinking that she needed something done with her nose because it's projecting far, but really it was the chin. So if we come back and you take a look here and you see the difference, you see what a gonial angle did. So when people talk about doing 1 to 2 vials of filler along the jawline, and especially in my videos I talk about the preauricular area, imagine doing 1 or 2 vials here where there is no bony support. Here there's bone, and even still, it's about 2 to 3 vials per side. And why is it that I talk about that in terms of volume? This person already looks pretty good, but she does need some volume there because a chin implant might be 20 mLs, of course. And so if we're adding 1 or 2 or 3 in the chin to bring the projection forward like we did here, that's going to take a few vials. And that isn't even discussing this all-important gonial angle. Look what it did here for this patient. So I hope that helps understand some of the jawline. I wanted to dive into this super quick and show you a jawline transformation. Remember, you can search on my channel here. So if you see where the arrow's pointing, you can go in and you can search where to find jawline videos or anything you want to find in the jawline. And I'm posting at the end card here and in below, I'm posting for you the link to a video, how do you achieve this, and showing it on a patient. And one of the videos that I will send you to is my Sculptra jawline video or jawline no exercises. Both of those you can search for in the toolbar, and that shows a gonial angle bolus as well as a microcannula injection along the edge. The benefit of doing it with something like Sculptra is going to be that you're going to tighten the skin. Okay, so you're going to tighten the skin, and that negates the need for doing anything like thermage, Ulthera, radio frequency. This person afterwards, if she was a little older, could certainly do it. Another good choice, I would say, especially this person's young with great skin, would be using something like Radius, okay, because it's calcium based, and that's going to save her money because it has the highest G prime of any of the fillers is calcium. So I hope that helps. Join me on this channel. Remember to like the videos, subscribe, stay tuned here. Keep your skin and body beautiful, healthy, and vibrant.